Hi, it's Jonathan Lau here. I'm going to go ahead and demonstrate for you how to do an ear insufflation treatment. So let's go ahead and get that set up. We've got our generator ready to go. You can use any generator. I'm not going to go through operation on this generator. You can watch a video on that on our YouTube channel, or just let us know and we can get you that. We're going to first connect up our cups directly to the outlet port of our Ozone generator. And I'm going to make sure that this is all connected up. This is, again, just particular to this generator, how this operates. But once we've got those connected, we can take our patient. I'm going to make sure my oxygen's open on the top, make sure I have oxygen in the tank, and then I'm going to turn the oxygen on a high speed of flow at first to let it purge the line quickly so I get pure oxygen into my Ozone generator and into the reactor area there. Once it's done that, I'll go ahead and slow that speed of flow down to what I'm going to use for the actual treatment. In this case, we're going to set it at a 9 on this particular regulator, which gives us about 35 micrograms per milliliter. We're going to go ahead and turn it off to the destruct on this and make sure that we have ozone flowing into the cups. Now, I haven't turned my generator on yet, so I actually don't have ozone running into the cups. I have oxygen running into the cups. But now I'm ready. I've got oxygen flowing in here. As soon as I hit the power button, I'm good to go. I can go treat my patient. So I'm going to go ahead and do that. It'll take me a few seconds, probably about 10 seconds, to get ozone out of the cups. What I'm going to do is simply take those and hold those directly over the ear canals and press them as tight as I can. You want to make sure that the ear canals are not dried out, so that the ozone absorbs a little bit better into the ear canals. So that is how you do it. We'll sit here for about 5 to 10 minutes. Ideally, without an oil bubbler, you want to make sure you have a fan blowing or an exhaust that's drawing the ozone that leaks out of the ear canal up and away from the patient and the applicator, so that we're not breathing it in. Now I'm going to demonstrate for you how to use this with an oil bubbler. It's really simple. All we're going to do is we're going to take a secondary tube like this. We're going to connect it to the outlet. We're going to connect our oil bubbler up here. And if you've seen the limb bagging video, it's similar to that. And we're going to begin bubbling right now because I have my generator off. My oxygen's still on. You'll see bubbles coming through there. That's oxygen bubbling into there. That means I have this connected correctly to the middle tube that goes down into the generator. Now, what I'm going to do is I'm going to take my cups, and I think you probably already guessed it. I'm going to connect those up to the other side of my oil bubbler here. Okay, and I've got oxygen now flowing into here, filling this up. It's pushing it out into the cups. Again, right now it's oxygen because I have not turned my generator on. Once I'm ready and once those lines are kind of purged and ready to go, I set my regulator to what I want it to be to get the correct amount of ozone, and then I can turn my generator on. In this case, what we have instead of ozone is we have ozonides and peroxides that begin to fill this container, and they will eventually make their way out the exhaust and to the ear canal of the patient. That allows us to safely breathe. The ozone, actually, again, it's ozonides and peroxides, and that's what we'll treat our patient with. Now, do keep in mind that if we do it this way, we are reducing the power of ozone a bit. So if we use an oil bubbler, if we have to, because we don't want to smell ozone, then we should treat longer if possible, maybe 5 to 10 minutes longer. So somewhere from 10 to 20 minutes would be a great treatment. With a pet, that can be challenging. So do as best you can with that, and you still will get some great efficacy, had some great results with this. That is how you do the ear insufflation treatment. Thank you for watching.